So we have a story, and I put this in my book, Stick It To Me, Baby. There was a couple, they were your patients. She called me and said, I'm preparing for an embryo transfer. I want to book you to meet me out there. And I said, well, I like to meet the patients beforehand so I can figure out how I could be the most help. Well, she had time on her side, sort of. So she came out to meet me, and she said that her husband, the two of them had done IVF a few times with no success, and they adopted a son. And then she came to me and said, now we're going to try IVF again, but my husband's sperm is fragmented in 57% of the strand. Yeah. Yeah. So I said, okay. And she said, what my doctor wants to do is he's going to, because I make a high number of eggs, he's going to take half of my eggs and fertilize them with my husband's sperm, and the other half will be fertilized with the donor sperm. And we had the chance to work together. He started his male vitamins. None of us knew how quickly it would take for the impact to change. I worked on her psyche, which was to help her to think differently than she told me, I'm never going to get excited about something, then I won't get disappointed. And I said, whoa, how about thinking different this time and say, like, I could think positive. I can look at what is working, and we have our son here already, whatever, like that. It's like a positive thinking example. But the data points is that 4 sperm from the husband and 4 from a donor. And in the Petri dish, it was the donor sperm embryos degraded, but 2 of the husband's sperm persisted. You put them in. She worked on her positive thinking, and it worked. Then 2 years later, she came back.
You know what? I had a similar experience as you just described.
Well, this is your patient.
Oh, that's right.
It's your patient.
There you go.
Yeah, so this was your patient. So she had 4 that were with the husband and 4 with the donor sperm. The donor sperm did not progress, and the husband's sperm did.
Yeah,
she got pregnant.
I remember that.
She came back and she wanted to try again. And then she was like, oh, now the pressure is really on me. And I said, or a reframe. You say, now I remember that this is important for me to think positive and look at what has worked. So at this point now, the DFI was like 25%. So the antioxidants were working.
Absolutely.
They did another IVF. She got pregnant again. And then there was another one, like another 2 years down the road. And his DFI was like almost minuscule. And again, it worked. So correcting that DNA fragmentation, he obviously stayed on his antioxidants, but also the couple just became happier people from being parents and having these healthy kids. The siblings to the adopted son, that kind of cracked their heart open. But that case was so outstanding. I remember just thinking, I can't believe it's working.
If there's any proof that correct nutrition and lifestyle makes a difference, this is definitely one of the most striking one when it comes to DNA fragmentation in the sperm. No question about it.
Yeah, it's just now the men are willing to take the antioxidant vitamins. I think that if they would come in for acupuncture, we could get faster success, maybe, because
I believe that, men. Well, first, with men, if the reason for that is something they're taking that they're not supposed to take,
right,
or that it's harmful, well, that, if possible, that should be eliminated. Some of them smoke pot a lot, and that can affect it if they can stop smoking pot. Some medications they take may be difficult to take them off, but they can definitely contribute. For example, hair loss medications can cause this. And when I tell guys, when I check with guys, I said, do you use hair loss medications? And he said, yes. I said, can you stop it? He said, really? I'm going to lose my hair. I said, how about you stop it for 3 months, freeze your sperm and go right back on it.
Mm-hmm.
And then in the meantime, take the right nutrition and so forth.
Mm-hmm.
So sometimes it's hard to convince them to do certain things, but if you tell them that it's not for a long time, if they can do it for enough time to just improve the sperm and immediately freeze the good sperm so they can have it forever, that would be a good idea.
Yeah. Well, this is a good segue into fertility, or infertility rather, subfertility, as a biomarker of humans' health, particularly the men. Here's the women. They're getting their teeth cleaned. They're doing all of their appointments. They are going for relaxation. They're working on themselves. They take so many supplements, self-care, yoga, all the things. But their male counterpart is busy making a living. I mean, she's making a living too, but he's not typically doing stress reduction, or he'll eat whatever is put in front of him, like a different mindset. And I don't know if you know Dr. Paul Turek, but he's a male urologist, and he's leading like the loudest voice about infertility as a male health biomarker. He says that IVF, and particularly ICSI, is the worst thing that could have happened to the male population.
That's in a way correct, because now you can solve all those problems easily.
And their health is potentially declining or not being addressed, their health concerns. What kind of health concerns do you think they should be maybe looking at before infertility shows up?
Well, I've been around long enough. I'm talking about really long enough, half a century almost, to see the decline overall in sperm parameters in men overall. I used to see men with low parameters occasionally, but now half the male that come have parameters that are below. In fact, they already lowered the standard of what is normal concentration, and still they fall below that. And I was been wondering over many times what happened in the past 20, 30 years to cause this, because... And I came to the conclusion that, yes, stress is one, but stress was always there. You know what I think? I think part of it is weight. More men are overweight, and being overweight affects the sperm in many ways. So nutrition comes into play, obviously.
Having sugar, Starbucks, but they're also more vegan or vegetarian. So there's those men are too thin.
Yeah, that I don't know. I'm not in a specialty like Dr. Turek is to answer those, but I'm just trying to. I mean, my specialty obviously is infertility, and it involves both of them, but it's emphasis on female infertility. When it comes to male infertility, I know enough, but I don't claim to know as much as Dr. Turek does. But I came to my own conclusion that one of the reasons should be simply the weight gain over the past couple of decades must be a contributor, because with weight gain, with reduced health in general, but also with weight gain specifically, temperature around the testicles increases, and that is the known negative for sperm production. There might be other reasons. For example, I think there's more intake of different medications by men than there used to be. I gave you an example of hair loss medication. I'm sure that's something that's more widespread now than it was 30 years ago, if it even existed. So there are certain medications that exist that could cause that as well. Smoking pot is more widespread. I think there are certain aspects of lifestyle that have evolved over the past 2-3 decades that have contributed to that. But there might be other reasons that I'm not aware of.
All right. Well, hopefully there will be more studies